Malan, editor of Bhekisisa Centre for Health Journalism, joins us now to discuss the rollout process of the COVID-19 vaccine that is arriving in the country tomorrow. Mia, good afternoon. Good to have you with us.
Thanks very much for having me.
Well, we heard in the week that the vaccines will be leaving India Sunday and arriving here on Monday at OR Tambo International Airport. But what also we heard was that there is some kind of a quarantine period, I don't know, of about 10 to 14 days that they are going to actually go through. When are we actually going to see the inoculation program start?
So we don't have a specific date yet, but we know that vaccinations can't start before samples of the vaccines that arrive tomorrow have been tested so that we know that they contain the correct ingredients. And that's why there will be a quarantine process, because while those samples are being tested, the vaccines will be in quarantine while they wait for those results. And the health minister last week said, as you've mentioned, these results will take between 10 and 14 days, and we can't distribute vaccines before that. So realistically, we're looking at around mid-February.
But that also essentially means the distribution process of these vaccines will only start after that 14-day period.
Yes, absolutely. The vaccines won't be able to travel from the warehouses to provinces until the vaccines have been cleared by the results of the tests, and then distribution will start. And that distribution will first be to provinces, either to central venues or sometimes directly to health facilities. We don't have a list of those facilities or venues yet, so we don't know exactly where they will be going, but we do know that BioVac, the company that normally handles the government's vaccine distribution, is the company that will distribute them, and they will take them to the venues in provinces, and from there it will be the health department's responsibility to get them to the vaccination centres.
How do we come to the figure of 1.2 million? Mia, are you aware?
Yes, so the 1.25 million health workers that the health department is referring to doesn't just include health workers that perform medical procedures. So it's not just doctors and nurses. It also includes cleaners and porters and receptionists, everyone who work in a health facility, because they are all very vulnerable to contracting the virus because they deal with patients who are infected.
As far as the nurses and doctors are concerned, what is the process? I know there is an electronic vaccine distribution portal, or EVD, I think that's what it's called. How does it work? Do they all need to be registered on that portal?
Yes, every single health worker would need to be registered, whether you're a medical worker, or a cleaner or a receptionist in a hospital. And so also everyone after this who will be eligible for vaccinations would also have to register. Once you've registered, you will receive an SMS as to where you will get vaccinated. That center will generally be close to your place of work. If that is the address that you entered, it's normally your work address that they ask for. And you will then receive a verification code that you will have to show to the vaccinator along with your ID so that they know it's the correct person. And once you have received your shot, you will receive another SMS that tells you that you have been vaccinated and tells you what is the date of the second shot that you would need to receive. In the case of the AstraZeneca vaccine that we're receiving tomorrow, our Ministerial Health Committee recommends that we wait 12 weeks until the second shot. And once you've had your second shot, you will receive an electronic vaccination certificate that confirms that you have been vaccinated. And you may wonder, how will we know which health workers will receive vaccinations first? Because the 1.25 million health workers are more than the vaccines that we will be receiving. We're receiving 1.5 million vaccines, 1 million tomorrow and 500,000 more at the end of this month. And each person needs 2 shots, so it won't be enough. We're looking at about between 700,000 and 750 health workers that will be covered. So the ones that will receive the vaccination first are the ones that are patient-facing healthcare workers. In other words, those directly working with patients, and also health workers that are exposed to procedures in theatres, such as aerosol procedures, that makes it easier to contract the virus. And once they've had their vaccinations, other workers that work with patients more indirectly, for instance, reception.
Mia Malan there. Sorry, we've lost you on that line because of technical issues, but get the gist of what is going to be happening, at least come mid-February.